What's up, y'all? Welcome to the Sports Medicine Broadcast, episode 114, Emergency Medicine, recorded October 8th, 2014. Our guests this week are Dr. Paul Allenye and Dr. Andrew Li. Dr. Paul Allenye is from Neighbors Emergency Center. He is the Chief Medical Officer for the one here in Pasadena at the Fairmont location. And just about the Neighbors Emergency Centers, if you don't have them in your community, they've been voted number one by many of their local communities as a alternative emergency room to like the big hospitals, those kind of things. So definitely check them out if you're in their neighborhood. Dr. Andrew Li is an assistant professor of primary care sports medicine for the UT Physicians. He's been in the profession for about 5 years, and he works right now with Memorial Hermann, and he is one of our doctors that does the sideline stuff, and we also takes care of our Saturday injury clinics. And so I've met Dr. Li a couple times, and so I'm excited to hear about emergency medicine from both these guys that have some pretty good experience. And then we also have joining us Dr. Mark Knobloch. Shakira, you switched to them. Dr. Mark Knobloch and Matt Barnes, right? All right. So they're joining us from the University of Houston Masters of Athletic Training Program again, and I'm always excited to have them. And as I was telling Dr. Knobloch via Twitter, that I love having future athletic trainers here on the show because, as you know, some of my students may be athletic trainers. Those guys in the Master of Athletic Training Program are going to be athletic trainers. So it's always good to have you guys and your students involved. So thanks again. I am your host, Jeremy Jackson, and with me today, Jose,
Bernice,
Shakira, Gabby,
Olivia, Jess.
And I already introduced those other guys, and they'll be talking here in a minute. If you want to join the show, Shakira is going to be watching the people that register and the CEUs. You can comment there in the comment section. Bob is on the Twitter hashtag TheSMB, so you can or tweeting directly to me at PHS Sports Med. Bernice is new on the Ustream social feature, so hopefully she'll see that if you use the Ustream. And again, links to those are on the website. Without much further ado, we're going to get right to it.
Dr. Allenye, please tell us who you are and what you do.
Hi, my name is Paul Allenye. I'm an emergency physician. For those that don't know what that is, if anyone's ever been to a hospital in an emergency room, the doctor that normally takes care of you if you have a broken bone, a cut, or if you're having abdominal pain or a fever, I'm that doctor that would come take care of you. The emergency department is considered the fail-safe for society when most people don't have a doctor or may not have insurance. They go to the emergency room because they need to be taken care of right away. Right now, there's a big push in the emergency rooms around the country because of that Ebola outbreak that everyone's very fearful of. So people like me or my colleagues are on the front lines having to deal with those potential patients. I've been in Houston, Texas for the past 12 years, board certified in emergency medicine. Currently, I'm the Chief Medical Officer of Neighbors Emergency Center, which is a conglomerate of freestanding emergency rooms here in Texas. We have locations in Pasadena at Center Street and Fairmont Parkway. We also have locations in Pearland, Kingwood, Baytown, and Bel Air. What is a freestanding emergency department? We have the same capabilities as the hospital emergency room, but what most people realize when they go to the hospital is that they end up waiting for very long periods of time. So anyone today, who's ever been to an emergency room, sometimes you'll be waiting 3, 4, 5 hours. I used to be on faculty at Ben Taub, and the wait sometimes there would be 24 hours before you got seen by a physician. So my group that got together and formed these freestanding emergency rooms realized that many patients, don't want to wait that length of time for treatment, and they can get better treatment rather than be rushed through the system. So that's a little bit about me, and I'm excited to hear about everyone else.
Can you talk briefly about your schedule?
Emergency medicine is one of the, I would say, the better schedules in medicine. The doctors in the previous generation before mine, those were the doctors that worked the 36 hours straight, go home, sleep for 4 hours, and get up and do it all over again. My generation of doctors started to realize, there needs to be a balance between being very dedicated to your profession as well as having a good lifestyle. So most emergency physicians work shift work, which means they work, 10 to 12 hours a day. and then they're off. They're never on call, meaning in medicine there's a very common thing. It's called being on call, which means you need to be responsive to your patients or to the hospital if someone has a need. Emergency medicine, since we do not have patients of our own, once you're off of work, no one's ever going to call you unless there's a shortage at the hospital or something. So in that way, I can spend time with you guys all here today and not have to worry about, I have a patient, I have 1 o'clock office, I got to get back to see my patients. There's a little bit more liberty in my schedule. And that also provides flexibility if I ever decide that, I want to move from Texas, I want to move to a different part of the country. I can just pick up and hit the ground running. I don't have to worry about building up a patient practice. So that was a long answer to a very short question of what my schedule is like. It's basically shift work where I work on average about 144 hours a month.
Dr. Lee, please tell us who you are and what you do.
Hello, everybody. My name is Dr. Andrew Lee. As stated before, I'm actually one of the primary care sports medicine doctors with UT Physicians. One of a few, but I'm basically out here on the southeast side of town. I do work in the Department of Orthopedics, and I do sports medicine coverage for Pasadena ISD. My board certification training is in primarily family medicine, and then I did a subspecialty training in sports medicine, which I absolutely love to do. My other location that we have clinic, which is a little bit different from Dr. Lean, is we do have clinic, which is over here at Memorial Hermann Southeast and Medical Plaza 1, as well as our second location in Pearland, 518 and 288. For the most part, my practice is based during regular business office hours, and we're almost the opposite to what Dr. Arlene does, and is pretty much regular scheduled hours from a Monday through Friday. But not only that, with my practice, I usually see a lot of sports injury clinics, sports injuries in those clinics, and usually they've been seen by an ER doctor first, or if not, seen by ourselves with some of our other providers, such as athletic trainers on the field during some gameplay as well. So usually, at least for our district over here, we have football games on Thursday, Friday, even Saturdays, and myself and a few other team physicians will cover those and be present during those games. And not only that, I do see patients during the week, usually after clinic hours, during some training room sessions to see if there are any other student athletes that were missed during that time. So other than that, we do try to see on-field emergencies, but we don't see any type of emergencies such as those in a freestanding ER or hospital ER that's more traditional.
Dr. Lean, I have a question for you, and this is off topic. But
Sure.
You brought up a great point. It's kind of a pet peeve of mine. You said a 24-hour wait in an emergency room.
Sure.
Kind of counterproductive. So my question is that more of a staffing issue, or is it more that people are flooding the ER with non-emergency problems? Because if it was truly an emergency, you'd think they get right in, they've got a heart attack or chest pains or severe bleeding. Would you say it's more that the hospital staffing is the issue, or that people are just flooding it with, my finger hurts, I'm going to go to the ER because I'll get seen faster? What would you say in your experience?
From my experience is that, the majority of people use the emergency department as a means of convenience. And so you're right. It's not the true emergencies. When you think of an emergency, that's very subjective. Having abdominal pain for 2 hours is an emergency to some people, whereas other people will be like, okay, I'm going to drink some water, or I'm going to drink a soda. Maybe it's just a little bit of gas. We'll see how I'll do, by tomorrow. Same thing. There's a lot of people that bring their babies in that have fevers. How long have you had fever for? Oh, the fever just started an hour ago. I don't think we're as a society, I don't think we've done a very good job of educating people about basic health care. They sell Motrin and Tylenol over the counter, yet some people don't really understand that Motrin and Tylenol are used for fever. And so I think I think the problem is really a cultural problem, in that we're very much an instant gratification society, and people, as soon as they start feeling bad, they feel as though that's not a normal state of existence and something needs to be done about it right away. That's why people oftentimes, they may have a runny nose, scratchy throat only for a day, but they already want antibiotics because they feel like, I'm getting sick, I just need to get this nipped in the bud. And that's part of the cycle of, or part of the problem where we're not properly educating people. But it's definitely not a staffing issue. It's really a matter of people don't have doctors, people don't have insurance, and people want convenience. That's the trifecta of why the emergency department is overcrowded. And I would say more so the fact that people don't have doctors and don't have insurance. And those two are very closely tied together, because obviously if you don't have any insurance, which means you may not have any money, what doctor is going to be willing to see you? And so the push for health care, Obamacare is, a really hot button issue in the country. It comes from good intentions, and I know people have different opinions, one side or the other. But at the end of the day, there needs to be a solution for people who can't fend for themselves, whether that be because they are too lazy to do that, or they have psychiatric issues, family issues. We as a society need to create a system that is a fail-safe other than the emergency department.
What are the worst case scenarios you see in your clinic?
Who do you want to start with? Who do you want to start with?
Mr. Allenye.
Dr. Allenye?
Yeah, Dr. Allenye.
All right.
Well, working in the emergency room, you basically, I say the only people who see things worse than what we do are the police officers and the firefighters who are and the EMS personnel who are the first responders. They see all the people that never even make it to the hospital, that aren't even worth being transported because they're in such a bad condition that, mortality is imminent. But in terms of what you see in the emergency room, it's not as exciting as when you watch Grey's Anatomy or ER. It's never like that, and things don't happen as quick as they do on TV. Someone comes in with a gunshot, and all of a sudden they have all these tubes in. Within 30 seconds, the patient's stabilized. That's not how things happen in real life. But I think when people say, like, what is the scariest or the weirdest thing you've ever seen, there's always the lady that presents to the emergency department who didn't know she was pregnant and saying, I have abdominal pain, and next thing you know, there's a baby being delivered. And it's like, this could have easily been avoided if you just, were honest. The thing about being in the emergency room is that it's one of these places that is, I don't know what the proper term is. It's not class sensitive. So what I mean by that is that you can take care of the CEO of a major corporation, and you can take care of a homeless person as well. And all those people are thrown into one environment, and it makes for a very interesting workplace. Emergency medicine is probably one of the few areas in medicine where people are not as politically correct and professional as you expect them to be. And I think that's just a way of people dealing with a very stressful environment, is to, kind of use sarcasm and off-color humor to get through a difficult situation. And so, just to be quick, if you want to hear about things I've seen, homeless people who have sores on their legs, they come in and they have maggots crawling through their skin. Oh. That's kind of disgusting. You have your traditional gunshots where people who are, wanting to shoot someone else or, shoot themselves, they miss, and then you see the outcome of what happens when that happens. I've seen people pour bleach, which is not bleach like what you have at home, Clorox. They're more industrial strength bleaches that are very basic, that you can pour on your skin, and they kind of burn through your skin like the Alien movies. If you've ever seen that, I've seen that when people pour that on one another. So those kind of things are very traumatizing.
All right, so Dr. Lee?
Well, I wish I had as much experience to say that we had that coming through our clinic, but at the same time, we're not the emergency room. So in our clinic, in the Department of Orthopedics, my colleagues, I'd say, would probably see some of the bone injuries, fractures, open fractures, those type of things that need to be consulted, which have to be taken to the operating room or operating theater. But as far as walking into the clinic, we hardly ever see anything as bad as that. Serious injuries, big topic of consideration in the sports world is concussion. So we do see things like that. Depending on the severity, those can last for a period of time as well. But, a lot of things that we see are usually screened out from the emergency room